everyone, this is Dr. Ellie with Middle Path Integrative Pediatrics located in Asheville, North Carolina. And I'm here today with my pod, I Heal Kids. And I just want to let you guys know, if you are an expecting parent, I have a holistic baby care webinar that I am so excited about. I've worked really, really hard on this, you guys. And it's April 4th. And it's holistic baby care from pregnancy until birth. We talk about toxins, we talk about nutrition. There's all kinds of valuable information, what to expect at the hospital or the birth center, all of that. And if you need that, go to my website, middlepathintegrativedpediatrics.com, and sign up because it's totally free. Should take about an hour, and really it's must-need information, so don't miss it. Today, we are talking to Dr. Amma Olson. So for all of you that don't know, Dr. Amma Olson is an amazing physical therapist. She's also an amazing yoga teacher, and she specializes in the treatment of scoliosis. She graduated with her Bachelor of Arts in Spanish from Berea College in Kentucky and studied abroad in El Salvador, Ecuador, and Spain. After graduating from Berea, she lived in Hawaii for almost 10 years, and she lived in an intentional community, which I would love to know about, and taught aerial yoga and dance. She was inspired as a teacher and went on to study physical therapy. And in 2021, Dr. Amma got her doctorate in physical therapy at Regis University in Denver, Colorado. For y'all that don't know, she also has an amazing YouTube channel, which I have checked out and is really awesome, and we will link it here, called Body Reset 321, where she teaches yoga nidra and also non-sleep deep rest practice, which I need all the time. So I will definitely be on there as well. She received her certification in physiotherapy scoliosis specific exercises from Barcelona's Scoliosis Physical Therapy Institute based on the Schroth method, which is a 3D postural awareness and breathing technique to improve spinal alignment and stability for people who have scoliosis, hyperkyphosis, and other spine disorders. She believes healing is a unique journey for each person, involving learning about building your relationship with their body to actualize physical comfort and live more purposeful lives. And she's honored to assist in this process. So Dr. Amma Olson, welcome today, and thank you for being with us.
You're welcome. I'm happy to be here.
So I was hoping we could just jump right in. Maybe you could tell us a little bit about your background, what inspired you to pursue a certification in scoliosis, hyperkyphosis, and other spinal disorders. And we'll definitely define those a little bit later on. But what has been your journey?
Well, as you said, I started my career in Hawaii teaching aerial, theater, dance, yoga, and I wanted to add a therapeutic element in, which is why I went back to school for physical therapy. And as I began practicing in the clinic, I saw the majority of people were spinal patients. Somewhere around 3/4 of what comes into the clinic is spine. And so that's when I started to look out there to see, okay, what are the methods that are being used to heal the spine? And I was looking for something a little bit more specific, since that goes with my personality type. And I came across the Schroth method. And I was very impressed of this method of utilizing breath to derotate the spine and elongate and heal. And that's kind of what led me to work with youth too, because that's the age when it really makes a difference. You can halt progress, reverse the curve some. And also just the opportunity to work with young people, being that you could affect the way they learn how to communicate with their body, how they learn how to heal, and those kind of things I wasn't seeing in the clinic from older people as well. Just the kind of agency or belief that they could heal. And I really felt like that was lacking as well.
Mm. So almost like taking so you started obviously seeing a lot of these patients, and then you wanted to almost take a more holistic approach, feeling like the body could heal from within. Yeah.
Yes, exactly.
Yeah. I think that I can relate to that as an integrative functional doctor for sure. So maybe before we just dive in to this huge topic, could you just kind of tell people, for those that don't know, what is scoliosis? What is hyperkyphosis? What are some of the spine conditions that you see? How are they different from each other? And, who can you help?
Yeah, the main two that we're thinking about with young people and even older are hyperkyphosis, which is the rounding of the spine if you've ever seen anybody with slouched posture, that is rounding of the spine. But when there becomes to be a lot of slouching, a lot of curve in the back of the body, that's going to enter into more of hyperkyphosis. And then scoliosis is defined by side-to-side curve, but it really is a three-dimensional curve, as we'll talk about. We can talk about it whenever, but the definition is from side to side. So usually you'll think that a person would potentially have the ribs to one side and the hips to the other, and that's kind of the side-to-side curve there. And then other spinal disorders, I like to just include all spine in what I'm doing. Anything that hurts, anything that feels like it's limiting you, and that can be anything from weakness to postural imbalance or some kind of disorder, as I said.
Okay, yeah. And, I do a lot of osteopathic work, which this kind of goes along with. It's like, it's easy to think of the body into 2D, 2 dimensions, where you're like just in this like kind of flat plane. But if people can envision like a bone, like a physical bone is, it's got height and breadth and depth to it. And so it can rotate in space. And I imagine that a lot of the work that you do focuses on that, because how can you adjust or correct for these structural problems by only focusing on the 2-dimensional world? And to your point, I love the idea of like the differentiation between hyperkyphosis and scoliosis. I almost think of hyperkyphosis as like, when you're sitting at a computer and your whole body like hunches over, but now you're like permanently in that position. And it makes me even think that I want to stand up straighter. And then scoliosis, I know a lot of my in my practice, I see a lot of kiddos that sort of develop it in their teen years when they go through a growth spurt, although it can certainly happen with infants as well, sadly. So I'm glad you're here to help. So I know you specialize in the Schroth method, which I just learned how to say. Thank you.
Very good pronunciation.
Yay! You got it right. We just learned that it's a German word, so I'm getting it right. So how does it differ from like other treatment for scoliosis and spinal disorders, and like how does it work?
So we're talking about the 3-dimension, and that's one of the biggest ways it differs. It's a 3-dimensional approach. So more of a classical approach would just be like when I said ribs to one side, hip to the other, is it just to kind of move in that side-to-side zone. And Schroth comes in 3-dimensionally and addresses the issue. And the breath is another key aspect, reshaping the torso with the breath. And you don't see that with other approaches at all. And another piece, there's a lot about the Schroth method, but another piece that I really love is the integration piece, especially for anybody really, actually. And after you do the exercise, you ask the person to stand there and feel their body and notice what they feel. And I love that. And I notice people have a hard time with it, and then they get better and better. Like, oh, I feel this, And so that is a key part of that method as well.
Oh my gosh. So this, I imagine, ties into your yoga teacher experience, because this is something that we do in yoga class all the time. Just like, how do you feel? And some days, honestly, you may have not thought, or at least maybe from my perspective, I'll just talk about me since it's my story. I may not have even thought about it all day. Or maybe I've noticed that my feet were cold, but I didn't even choose to address it, or something silly like that. And so I think it is an interesting thing to actually put ourselves inside our bodies and even notice what's going on. And I imagine, especially as a young person that may not have been exposed to some of these approaches before, it may be difficult to even be aware of how they're feeling. So maybe we get a little more granular. So like if someone has a kiddo and they have scoliosis and they want to do the Schroth method, we're going to have to practice what Schroth method with you in an appointment, and they come in, like, what does that appointment look like? Like, what are you doing with that child?
Well, another element that I didn't talk about is education. And this is an interesting aspect, because in the PT world, because of the progress in pain neuroscience, which I'm very into, and a lot of fear, PTs have shied away from giving specific information about what's happening because it causes fear. But with this population, you really have to tell them what's going on. So you might even sit down with the image and show them what's happening and touch their body. So that's a really good place to start. And then treatment would include, just a few postures, not very many. And you practice the expansion technique. You utilize props to also rotate and add pressure in places. And then they're asked to kind of see how they feel. And then at the end, you do something kind of fun to try to hold, like a beanbag toss, to try to hold the posture. It's something a little bit more fun, or walking along and trying to balance as well, so that it's more dynamic. And that's kind of a general treatment setup.
Okay. So when they come in, so how does the three-dimensional posture awareness and breathing techniques like specifically improve the spinal alignment and the spinal stability?
Yes. So try not to get too technical. If we think about the rib cage or the torso, and we're looking at the circumference of it, it can be almost an oval shape. And what we have with abnormalities or even poor posture, because if you round forward, you can actually feel a bowing of the back and then the concavity of the front. So that shape is going to change depending on the individual and how they're sitting and the spine. And so what we're thinking about as when you inhale, we have expansion. And when we exhale, there can be contraction, but that's what the Schroth method does, is you inhale and expand, and on the exhale, you hold through muscle activation the posture. And then now, not to go too technical, but with the Schroth method, we're going to target specific areas to expand, which will then help the spine to return to a normal balance, such as if there's a concavity on the right, we're going to expand that, and then the opposite side would be in the other way. And so it comes all the way up and down the spine, and it gets a little technical.
Okay, so I'm kind of imagining like breath work where you take a deep breath, and correct me if this is not correct, but it's almost like breathing into the segment of the spine or the area around the spine that needs to correct. And then that pressure or expanse of the breath is actually sort of physically adjusting the spine into alignment and correction.
Yes. And what's really cool about it is, so that rotational element is, so the spine isn't just moving side to side or front to back, but there's a rotation element too. And so if the breath is targeted correctly, you have a derotation of the spine occurring, and through the internal volume, and then through the muscle activation, you'll keep it high, you'll keep it big. And that's how that goes.
Oh my gosh, this is amazing. Okay, so
we're
actually using breath, the pressure of the air movement, the physical structure of the body to kind of stabilize our bones in our back so that we're not getting out of alignment. And I imagine, I'm thinking even for myself that this could be something that's really helpful. So, not even if you have true medical kyphosis or scoliosis, but, just ergonomics. So I see that all day long because I do a lot of osteopathic work, which for those of you who don't know is a type of body work to kind of help adjust things as well. But I see a lot of ergonomic stuff in kiddos, especially because of computers. So we're like this all day. And then for myself, I'm mousing all day and I've got this like shoulder rotation that causes spinal stuff. And so I'm thinking about, people that would benefit from this would be not only those with a medical diagnosis like kyphosis or scoliosis, but even if you're just feeling pain from positioning, would that be like an appropriate person to come and see you as well?
Yes. I utilize this method to teach postural stuff, and that's ergonomics related. Anything spine, I really believe in, will benefit from breath work and this kind of exercise.
Okay. So as a pediatrician, I know that working with kids is very different than working with adults. So do you mind kind of diving into why, working with young people with scoliosis requires a different approach than when you treat adults with the same condition?
Well, one of the big things is adults are usually coming for pain, and the child is not, or the teenager is not usually having pain. Actually, it's
Okay.
just more to make sure that curve doesn't keep going. So that's the big difference there. Um, and Also, I feel like you have to think about um, the purpose. The older adult is usually seeking pain relief. The child might be, and it's interesting. I'd like for everybody to focus on function, but the child might be more interested in how can I make sure I can do all my sports correctly and have a good life. But I do wish that would happen in both groups. But unfortunately, there's a lot of focus on pain with the adults. Rather than that, it's going to be the same postures, but the children are just more flexible, and there's a lot more to consider with the adults because they have injuries and such. So you can give them more to work on, the children more to work on, and probably use less modifications and less props, just depending on the individual.
Okay. I think this is a really good point, and actually maybe like a note for me and my life is like, okay, yes, I've got like that rotational pain from mousing all day. And like, is it affecting my ability to do yoga and my ability to work in the garden and all of this? And that may be something for those of us who are over 18 to sort of think about, and like a good note from that pediatric population. Thank you, kids, for
Yeah.
letting us know that we do have a life. And also, I think just from the perspective of if you have a kid, just because they're not in pain doesn't mean there's not an issue. And so I imagine that might come up too as a question, like, do I need to even come in? They seem fine. They're not in pain. Um, but to your point, it seems like things could worsen over time. And we really want to just make sure that it doesn't, so that they have a fulfilling and successful life, sports wise or otherwise. Yeah.
Yes, and then a really important note, probably won't have pain, but the major progression is going to happen during the growth spurt. So that's another reason it's really important to get the kiddo in, just because that's really that doesn't mean you can't, after the growth spurt, you can't come in and you won't benefit as well. There's always to learn about the posture, but that's the time when you can really make the difference.
Mm. So
Mm-hmm.
this is when we're talking about early intervention. It's like before it gets really bad. And I feel like when I talk to therapists in general, whatever the specialty may be, I think like the recommendation in general is to come in as soon as possible, because things do tend to progress. So I'm kind of wondering, like, what role does the patient's awareness of their own body play in the healing process? Like, how aware do they need to be, or can they be just not aware?
This is my favorite question. This is what I do my work for, really. Um, I think awareness plays a big role. And I have kind of how I talk to people about it is I tell them, I believe the body is constantly communicating with us, and that I'm not sure why, but we've become cut off from that communication. And when we feel pain, it's actually the body screaming at that point, and this gets our attention. Unfortunate part about that is once we feel pain, it actually, to repair that relationship could take a while. It could take seconds. But I do see there has to be a process involved usually. And as concerning kids, and we can kind of reflect on adults as well, but um, I think awareness plays a big role in learning that we can heal our own bodies through self-exploration, through learning about our bodies, through communicating. And that's what I'm seeing in adults, that they've forgotten or don't believe. And I think it's a really good time to start introducing that concept to a child and a teenager.
Mm-hmm. I love this because this is all in my world about the mind body connection. And I'm always talking about that we have this thing right here. It's called the neck. And it's so nice. It attaches our mind to our bodies, and we talk back and forth. And I think it's just so easy to feel out of body or disconnected because we're on the phone or we're distracted by technology or we're, involved in work to the point that we don't even notice, are we hungry or irritable or tired? And I think to your point around children in particular, it's so nice to teach them these skills early because then they're able to self-regulate a little bit better. They're able to notice what their needs are so they can address them. They're able to relax and induce the parasympathetic nervous system, the relax and digest part of ourselves. And they may even be able to allow themselves to be bored, which is shocking that we have to talk about boredom. But boredom is so important for imagination, growth, development. And I think oftentimes, and I'll even speak to just my own experience or lived experiences, it's very easy the minute that you do have free time to immediately be back on a device or something like that. And I think with kids, sometimes, if they express boredom or they say something about being bored, the natural tendency and understandably is to quote unquote fix the problem. But in reality, that boredom allows them to use parts of their body and mind in different and more creative ways. So I went off on a little bit of a tangent there, but mind body is so helpful for regulating, as you know, in your yoga work as well, but like the vagal tone, which is how we relax and maintain balance in our bodies. So yeah, let's teach our kids to be aware of their bodies. And not just in their minds, I think also the physical body as well. I think we're going to be talking to someone who's making a book for girls about their body parts. And, so important to even just learn what our body parts are named so that, for health purposes, we can have conversations with health professionals, mothers, people in our lives that we need to chat about these things. So important to teach kids. Okay, got off on a little tangent, but how do you collaborate with people like healthcare professionals, orthopedic surgeons? Like, let's say someone's seeing an orthopod and now they're seeing you. How does that all mix together? What's that relationship like?
Well, in this busy world, documentation is really one of the main areas. I do progress notes, which are a good, concise way to my observation about bracing, about curve progression, for you, the pediatric, anything with overall health noted. If anything comes up that seems more like this needs to go over, of course, if it wasn't a progress note day, I could just go ahead and send that note over. What we're doing right now is collaborating, and I am very open to that. And I'm hoping that I do more and see more of this kind of thing in the future of just talking interprofessionally.
Yeah. Yeah, I agree. I think it's so important and it is easy to get so busy. And those notes are great. They're so helpful. Sometimes I have to say that I actually will refer to someone and I don't receive a note. And then I'm not sure what's going on. And then I'm trying to call. And so the fact that you are able to provide all of that is so helpful. And I think too, there's kind of that relationship I would imagine between you and pediatricians or orthopods where it's like, is this something that needs surgery? And I imagine that if it's to that point, there is probably some discussion between parents and the orthopedic specialist. And I would imagine you're involved in that as well, because so important to decide if this is something that needs that level of intervention, and hopefully not. Do you find that there are times where maybe someone's scoliosis has just progressed to the point that they need surgery, or when would you think about, gosh, this is working really, has been working well, but we've kind of reached our limit? What do you think about that with patients?
So when we're thinking about surgery, and I said this, the side to side curve is what defines scoliosis. When it's more than 50 is when there's conversation. And believe it or not, one of the main reasons there's conversations, especially with a younger person, is appearance, because it doesn't look as like other people's spines. So actually one of the leading causes of surgery with a younger person is appearance. Yes. So, but as you, because I have seen people over 50 degrees of that curve who decide not to do surgery and are fine. They have to be very dedicated, exercises and posture work. But then kind of later on in life, if you're dealing with a lot of pain, that's then the other reason that people will go in or if you're younger and you're having pain as well. So pain and appearance are the two leading causes. And then other than that, I think it's kind of the preference of the patient. Like what do they want, you know?
Yeah. Yeah. I imagine that is a big aspect, the psychosocial aspect on the minds of young people, because as we know, it's not always easy living in a world when you appear differently. So important to think about psychosocial on top of the degree of curvature, which for people that don't know, scoliosis is measured by what's called a Cobb angle. And this is a really technical term to measure the degrees of curvature. And there's different ways to do that. And some people will do it with x-ray, and some people have scoliometers and all of that. And if those degrees progress, then sometimes the orthopedist may recommend surgery for different things. One, in my experience, and maybe you can express more, Dr. Olson, but so difficulty breathing, restrictions with breathing. I've seen surgery for that in particular. And then to your point, pain, and then also the psychosocial aspect. But anything else you can think of that's physical that would be
cause
for surgery?
Let's see. I have a patient right now that can't stand up straight. She's still not thinking about surgery, but that would be a good reason because she has to walk kind of hunched forward. There is digestive. That's, you can get into the digestive cavity with that curve as well. So if there's like some severe digestive problems, one might think that that's caused, could be related to the scoliosis. Yeah.
Okay. Well, and I'm glad, this kind of circles back to what we were talking about early intervention. So if we can, trying to avoid getting to this point and getting in as soon as possible and not waiting just to kind of, wait and see. I think that is such a key point to working with you. So for parents and caregivers, people who are just, beginning to learn about scoliosis, what steps do you recommend to ensure they're making informed decisions? What should they do?
What steps? Well, they need to be checking in with you. If they haven't come to you to look at the overall health, that's a key aspect. And then also you need to be in with the orthopedic specialist or a surgeon. There's imaging that should be done regularly so you can monitor the curve progression. And then, of course, with me, and then probably suggest a mental health therapist as well, just because we're talking about the psychosocial aspect of having a body that might look a little different than other people. Those are the key aspects when we're thinking about bracing as well as a part. You're going to be dealing with the orthopedist about that, and you want to think about a three-dimensional brace, which is kind of more the newer version of it, and that's kind of important as well.
And when you're talking about bracing, these are like those little plastic vests that people sometimes wear. Is that kind of how it looks? Or how does it look nowadays? Because back in the day, there was some serious hardware involved, and people have I don't know if y'all saw Romy and Michelle's wedding from back in the day, but people have that picture in their mind of that's what bracing looks like.
The braces nowadays, they're plastic, and the length of the torso. And this is kind of a point I want to kind of emphasize here is the braces that are just pressure in all directions are still getting prescribed, and those aren't as effective. The braces I'm talking about, you'll actually see they're relatively lightweight, and you will have to kind of lace them on as well, but you'll see pressure in one area, expansion area in the other. But not super bulky, and you could put your clothes on over top of them and not going to notice it.
Okay, good to know. I love your suggestion, by the way, that people seek mental health therapy, counseling support groups, all of that, because I think that is something that, I admit that I personally maybe haven't thought about, unless someone's having some other mental health concerns, it's like, yeah, this is like a big deal. This is something that we should think about as, we're walking through the world differently and we could use some support with. So I'm going to definitely start making those referrals more often, along with doing the imaging and then referring to you and the orthopedic, because we really need to not miss mental health. It's such an issue in today's world. Maybe I need to bring on a psychotherapist. Okay. So where can listeners find you, Dr. Olson? So everyone's going to want to see you. Everyone who has any ergonomic spine issues, scoliosis, hyperkyphosis, they need you. Where are you? What's your number?
So I work at One-on-One Physical Therapy, and that they have a website, One-on-One PT, Asheville.com, or you can just call One-on-One Physical Therapy and ask for Alma Olson. And also, I definitely would want you to email me directly even before you make an appointment if you have any questions. And I have an email, bodyreset321@gmail.com.
Amazing. And if people need some deep sleep or non-sleep rest, tell us that link again where they can do the yoga nidra and all of that.
So it's the Body Reset 321 on YouTube. Okay. And that's with my name, Alma Olson.
Perfect. Oh my gosh. Well, thank you so much for being on and speaking with everyone today. And if you don't know me, I'm Dr. Ellie. I'm with Middle Path Integrative Pediatrics. I see kiddos 0 to 21 for holistic health and other people 2 to 102 for functional medicine. Please reach out for me for that. I also have a webinar coming up April 4th for holistic newborn care from pregnancy until birth. So if you know any expecting parents, have them sign up to that. It's completely free, no fluff, and 100% valuable in my opinion. Okay, wishing you guys well. Bye.